So the aim of value-based insurance design is actually to improve individual and population health. I did not go to medical school to learn how to save people money, but we understand that the fiscal responsibility and the pressures faced by public and private payers are real. So while most people are focusing on the total cost of care, the real attention of value-based insurance design is what patients pay out of pocket. We like to say Americans don't care about healthcare costs, they care about what it costs them. And it's our hope that through the levers that are facing consumers, that they will purchase more of the things that make them healthier and less of the things that don't. And we've used a whole number of different ideas to convey this. We've used a whole bunch of different graphics to convey this idea. The most recent has been an iceberg, where the tip of the iceberg above the water is what patients pay, and the total iceberg is what sophisticated payers, public and private, need to worry about. It's our belief that you could deal with shrinking the tip of the iceberg, which my patients care about, simultaneously with efforts to lower or shrink the overall iceberg. And that it's our hope that we're not going to change prices per se, but in the short term reduce what patients pay out of pocket for high value services, and to pay for them to increase what patients pay out of pocket for low value care, to technically raise the water level to shrink the tip of the iceberg for high value services, and shrink almost in its entirety the low value care services. And if you could follow this visual, that the melting of the low value care iceberg will provide that headroom or increased level of water coverage to make the tip of the iceberg for the high value care to go down.